The first case I actually saw was in '85 when I came back to the UK and I worked as an infectious diseases registrar. I remember this very ill, terminally ill man being admitted really just for terminal care. I don't think that people at the time realised how big HIV was going to be. How could we? We just heard about it initially from an outbreak amongst gay men in America and amongst immigrants from Haiti into America. I seem to remember those were the two groups where it was first diagnosed. We looked after a great deal of HIV/AIDS patients, but the problem was still the same, that as fast as we would diagnose new people with HIV/AIDS, many of our old patients would die. We could treat their acute infections as best we could, but eventually they died, and palliative medicine was almost a second nature to us. There wasn't really any effective treatment up until about 1995. We had monotherapy with AZT in the late 80s, and we had dual therapy in the early 90s, but these only bought people a little bit of time. The fact was that people with terminal AIDS knew that they were going to die, and so in some cases they decided to end their life on their terms and not let the disease do it. So again, I have memories of some people who I would call very brave, saying, I'm going to go out on my terms with my friends and family with me. The first effective treatment for HIV came along in the mid to late 80s, AZT, which was difficult to take, had quite a lot of side effects, and it prolonged people's lives on average by about 6 months, but after that the virus became resistant. The big change came around about 94-95 with the introduction of a new class of drugs called the protease inhibitors, and then we started giving people treatment with triple therapy, and triple therapy worked indefinitely. If you give 3 drugs at the same time, and they are taken well by the patient, then the virus finds it pretty well impossible to become resistant to all 3. The virus levels fell, the immune system rose, people got better. And it was like almost flicking a light switch. So we were looking after people who were almost inevitably going to die up until 92, 93. 94, 95, we suddenly were able to say to them, you're going to live a long time now. And then as drugs got better, as knowledge improved, we're now in a situation where if I see someone today with HIV, I say to them, look, as far as I'm concerned, you are going to live a normal length of life. I think there is a strong chance that we will find a cure for HIV, but when that is going to happen, I don't know. There's been so many false dawns and so many stories of people purporting to have found a cure and haven't. As far as I'm aware, there are only 2 cases of patients ever being cured of HIV, and those were in very exceptional circumstances.